Welcome to Love and Speak the Truth, a podcast with Sister B and friends. It might get messy, sacred to secular. Don't judge. All voices will be heard here. So listen up. We're going to explore the human experience through the lens of wisdom sharing and faith, with a worldview that might shock you, move you, even downright inspire you. And welcome today, Trish Cassidy. She is someone you should know. She's worked in Catholic health systems at top levels for 30 years. She is super intelligent, having heart and soul for people and policies that create environments of care, respect, responsibility, and super effective management. She is someone that carries the heart in the system. She understands systems and she knows how to make things better for people. So listen in and learn. So good to have you on, Trish. I think that I have not seen you in a while, but this will be exciting. I think one of the things that I'm excited about sharing with our little listening population is you have always had this big title. Since I've known you, you've been one of the big wigs and one of the suits I used to call you at the medical school.
Yes, yeah.
Um, but you've always also been the heart of so much of the administration in my
You.
experience. So
You.
it'll be good to just have a relaxing conversation and have our audience get to know you a little bit. So welcome.
Thank you. Thank you for asking me, Brenda. I'm happy to be here. Really happy to be here today.
So, Trisha, I want to know if we could just start off with just sharing with the audience a little bit about yourself, some things perhaps that you're passionate about, maybe a little bit about your own background, your family, or wherever you'd like to start so we can get to know you a little bit.
Okay. Well, in many ways, my career has been one of my biggest passions. So we can talk about that a little bit, but my career in healthcare has been one of my biggest passions. And I'm really passionate about family and friends. I come from a big Irish family. I'm one of 8 children, and we currently have, between my husband and myself, we currently have, I think we counted 23 nieces and nephews
Mm.
among our tribe. And in my side of the family alone, when we're all together, it's 43, and any day now 44 people.
Uh,
So, so we are a big group, and I love that. I love being with my family. I love the conversation and the complexity of all those relationships, and the love of such a large family is really wonderful and important to me. In my career, I've spent most of my career working in faith-based and mainly Catholic healthcare. And I have loved that work. I've been a healthcare administrator. Much of my work has been focused on healthcare strategy in both at a large academic medical center that was Catholic and then a very large health system in the Chicago area.
mhm.
And that career has taken me places that I would have never in my life imagined. I've met people I would never have expected to meet. And I feel like I've been so blessed with both you say bigwig, and both those kind of bigwig people that I had an opportunity to meet and learn from, but also just being with people at some of the patients primarily, but at some of the best and worst times of their lives, which I think is really where the blessing comes in all of that I've been able to do. So it's been wonderful.
Yes, I've kind of witnessed that in your value system, how the whole focus of patient care, the whole strategy of your planning and your developing is all about building that sense of trust and that sense of being available to people to teach and to learn and so on. So let me just ask you, how do you think healthcare's changed over the last, say, 10 years?
Oh, it's gotten really difficult. And I feel like healthcare right now is in crisis. Some of that precipitated by COVID, but I think it was a train that was already on a track, and then COVID really put it on a downhill track of escalation, that crisis. I think the expectations of healthcare in the United States, particularly, I can't really speak for the rest of the world, although I have some experience in other places, but the expectations of healthcare in the United States are so high, and the desire to be the best all the time, to have the newest, the latest, be the first, those are wonderful aspirations that have helped many, many, many people. So I don't want to put that down, but it also has created a financial crisis. And I think even a burnout crisis among providers who feel like maybe they can't ever be good enough. We've created a wonderful system of electronic medical record where patients' information is available to people all over the world and all over the country. But at the same time, that has reduced personal interaction between providers.
Mhm.
So if you were a radiologist and I was an internal medicine physician and you read an x-ray for one of my patients, and you might show me the x-ray and explain to me what you saw in the old days. Now on my computer, I get a message from you that says, this is what I saw, here's the picture, and we never talk. So my knowledge and my connections are being reduced to spending time looking at my computer, or even in the patient exam room, right? I'm typing notes into my computer and not maybe making eye contact with my patient. That's gotten better. People have become more aware of that and are really working to make it better. I think we're in a time of crisis in terms of people recognizing that maybe we've lost some of the care that used to come with healthcare.
Mhm.
We're providing excellent medicine or excellent surgery or excellent, whatever, but some of the caring is getting pushed to the side because we need to be faster and we have a lot of demands on the people providing the care, and the costs are high and patients are stressed, and people want healthcare to be a sure thing, and it's not a sure thing. So I think we will find a way through it, but I think it'll take a little bit of time for people to come to understand what the next step is. I don't
Yeah.
think we figured out the next step.
I want to just jump in on some of the experience that I had dealing with you and the administration that you were a part of for so many years. In this sense that the relationship with the patients were significant in such a way, I think we called it patient-centered medicine. And I think one of the things you're saying in this whole disconnect with the rising notion that efficiency and allowing this computer-generated communication system to lead the way, one of the things that gets lost is the attention to the relationship with your patient, right?
That's right. And that's always been a struggle because people are busy, and you, like in any profession, you become accustomed to the things that happen every day.
Mhm,
And so it takes some work to remember that nobody wants to have to receive health care. Nobody wakes up in the morning and says, boy, I would love to go have a surgery today.
mhm,
So, but for us, we say, oh, we do this all the time. Don't worry, everything will be fine. Well, you might do it all the time, but I never do it. I've never done it before. I have no idea what this is going to be in my life. The thing that I worry about is that we're dehumanizing healthcare.
yeah,
And that's the worst thing that could happen because we weren't great at humanizing it before, but now the demands and the technology and a lot of things are putting even more barriers between providers and patients, and providers and providers. So I think we have to be so alert to remember that what I do every day, every 15 minutes, I see a new patient in an exam room. I open the door, someone's in there. I ask them what's wrong. I try and help them. I go on to the next patient, right? But for them, they might have been nervous for 6 months to make this appointment and to come and say, I have this pain, thinking the whole time I have a brain tumor or I have this or I have that, and you walk in and you're like, okay, well, everything's fine. You can go. And they haven't really told you about what their
mhm,
worries are because
mhm, mhm.
there's not enough time to get to that point of comfort. I grew up in a family, my father was a physician, and he used to say, before I walk out of the room, I stop before I open the door, hand on the doorknob maybe, but before I open the door, I stop and say, is there anything you want to tell me that we haven't talked about today? Anything I didn't ask you that you wish I would have asked you? He would say, often that's when the real thing comes out. What I'm really worried about, doc, is this lump in my armpit or whatever, whatever it is. And we have to make sure we leave time for that last question.
How does strategy play into setting a course for healthcare or providing healthcare that can develop perhaps that idea of relationship, that idea of developing relationships with patients? How do you navigate that?
There are several things. I feel fortunate that I've had the opportunity to have input on so many things, throughout my whole career. So many times I got to sit at the table and be part of the conversation. And I think strategy in part is what services should we be providing and where should we be providing them? So one of the things I always tried to be very cognizant of is what's easiest and best for the patient. There are services like radiation oncology, when patients have to have radiation treatments for cancer. Those pieces of equipment are big. They require a lot of, you build them in a huge vault that protects the radiation, keeps the radiation inside. They're expensive, and it's not very easy to put them in very many places. But patients often have to go every day for a radiation treatment. It might only take 10 minutes, but they have to be there every single day. So we would try and figure out things like, let's make the parking so they can pull right up, get out of their car, walk in, have the service, and get right back to their car. Whereas for other services, people might have to park in a parking garage and walk, down a long hallway or whatever. But things like that, where you try and keep cognizant of a mom coming for an OB visit might have to bring a young child with her. So let's make sure that there's a place for that child to play, both in the exam room or, wherever they might have to be. And making sure that you help people when they arrive, make them feel recognized. I used to go around to some of the clinic desks and I would just stand and wait and see how long it took for someone to look up and greet me. And they're busy, they're working, they don't mean to not be paying attention, but really their very most important job is to make the people in that clinic feel comfortable, right? So reminding people of, again, for you, this is work, but for them, it feels like life or death. And maybe it's not, maybe it's nothing. The patient doesn't always know that. So those kinds of things would be built into what we did. Again, that distribution of services, trying to make it easy for people, encouraging people to seek primary care, preventive care, programs that made it easy for them to get preventive care, trying to reduce some of the scariness by explaining on a website, like, here's what an operating room looks like. It's not that scary, but now you'll know when you get there, this is what you're going to see.
If I'm getting this right, you're like the architect of the experience, the physical experience, the medical experience, the way that people engage with the system itself. You kind of plan that out or look at the big picture of what people experience when they come into the system.
And some of it was looking at where people live in a community and where they would want services, or where people travel. Where do they go to buy their groceries? Where do they go to, buy a pair of blue jeans? We should be there so that we're convenient for them, because that's where they're going anyway. Many places during the time of my career, many places actually created a position for a chief experience officer. And that person really looked at, when you walk into a patient's room in the hospital, does everybody announce who they are and what their job is, so that the patient knows it's not just one more person in scrubs who came in here and I don't know why you're here. Those kinds of things are really important.
One of the things I noticed in your administration, and that I found very much lacking lately, is this idea that every person in the hospital, in the clinic, had the responsibility almost that your job was also involved in caring for the patient. For instance, if you're the housekeeping person, If you're the person that drives the patient down the hall to their next room, even the people who open the door when they come or receive you at the desk, you're a part of that patient's experience and that patient care.
I think every healthcare organization feels like it has a mission to take care of patients, that a general mission to do that. I wouldn't ever say that that wasn't the case, but I do think that Catholic healthcare clearly has made some specific efforts to make sure that those who are less fortunate are never made to feel less, so that's one thing, that you treat everyone beautifully, no matter how difficult their circumstances might be.
Whether
I
you
think
could
that's
pay or if you can't pay.
right. Right. I think that's really important, and to not make people feel less because they can't pay. That's a beautiful mission. And then in our particular circumstances, when you and I worked together, we had this mission and we coined a phrase of we also treat the human spirit, which was a simple way for everybody to remember it's not just about giving the shot. It's about making sure the person's not scared when they get the shot. And healthcare people tend to be very empathetic anyway. That's one of the reasons they like that career. So it's not like it was a hard sell. It was just, it gave people kind of that rallying cry to say, right, we are here to make sure you not only physically feel better, but we're going to make sure that you feel supported and safe and, comfortable. And it's hard. I mean, a lot of patients aren't going to get well. They are not going to have a cure. And I have always felt that in those circumstances, our role was to help them understand they might be healed. They might find healing without being cured. Death is something we're fearful of, and maybe we could help make it less scary, to bring some peace to that process, and certainly support their physical needs during that time too, to just make it so that no one felt alone.
Intention is so important. I'm finding that some healthcare systems, because of cost and because of trying to compete with other systems in local areas, and I'm thinking of Chicago area,
Mhm.
and in that competition and trying to keep costs down and trying to provide services when the payment structure is not always up to par. I'm finding that systems are cutting, say, from the spiritual care programs, pastoral care programs.
Yes, yes. Yeah.
Uh, the thing that strikes me about the way you go about creating this big picture experience is that you do have somehow that Catholic, and it may not be only Catholics, but that journey of the Paschal mystery of the life, death, and resurrection process of life and faith, belonging, and moving into the different transitions of life. That's all a part of the package. How do you see the significance of that Catholic identity of the Paschal mystery in your work?
It has to be part of everything, right? It's the foundation, really, of what we do. We, in healthcare, we often are not very good at the death part, even though so much of what we deal with is death. But that's kind of the enemy, we make it the enemy because curing somebody is the goal. So one of the ways that I think we can be better is if we recognize that there's a lot we can do for people. I worked with a nurse once who said, we should never say to someone, there's nothing more we can do for you, because there's always something more we can do for you. You won't get better, but we'll be with you every step of the way on your journey. And that journey doesn't have to be painful, and it doesn't have to be alone. And I think that if we don't include all of that in our planning, we're not living up to our mission, and we're not living up to our faith. So, we all say death isn't something to fear. Well, it's easy to say death isn't something to fear until someone tells you you're dying. And then here we are, and we say, okay, well, maybe 6 months, maybe 3 months, but get your affairs in order, whatever, all those things that people say that are the euphemism for you're dying. And I think in showing our faith about it, we can give people comfort, in making it clear. And in my own life, those times when I was most engaged in someone's suffering or most engaged in a patient's death, or, and that didn't happen very often in my work. I mean, I was mostly in a suit and an office, but there were times when obviously we would interact with families or patients, or those were moments of grace. I mean, such beautiful grace. And that is where you see the life of Jesus come to play in
Yeah.
healthcare, right? And it could be just a moment or it could be a whole experience. But I think we all like a birth. Oh my gosh, tremendous grace. So making sure that we build that into our expectations of how we care for people is really important. And I think even in their times of horrible pain, those are moments where we need to feel grace and feel the presence of, a healing Jesus who can help us help that person.
Mhm.
Right. I guess that's what I've always thought, is that even from my desk, I was doing my part in carrying out that mission, and certainly supporting the caregivers who that can be tiresome. That's a hard life to live every day, to say, oh, okay, I'm just going to rely on my faith to make it okay that this mom of 3 is going to die tomorrow. That's a lot to ask of anybody. And so also to make sure those people are cared for. And I think we did in our work, we had a very wonderful chaplain team that was very cognizant of the cost to healthcare workers of losing patients. So I was looking up while we were talking. I just looked to see Sister Irene Krauss. I don't know if you know that name, but Sister Irene Krauss coined the phrase "no margin, no mission," and she ran a healthcare system. And her comment, obviously meaning if we can't pay for it, we can't do it. So we have to make sure that we balance this issue of margin and mission. And I think sometimes the margin part gets ahead of the mission part a little bit. And I feel as though if you make sure that both things are in your sights, you can make it work. You can keep mission and margin in balance, or make sure that one doesn't get ahead of the other. Obviously, you can't provide all free care, even though in a missionary sense you would love to do that. But then, people do have to work and eat and pay their bills. So you have to pay your staff, right? But I think that balance is the thing that I have found most exhausting in my career. How do you say yes to this person and no to this person because you're trying to make sure that you can take care of more people? It's a very difficult balance.
In my experience and listening to you share this whole idea of keeping both of those in your sights, that's the work part of it. That's
Right.
the part that makes it exhausting to be able to find the money to do the things you want to do, that
Yeah.
you find essential to do, right? And not always being able to strike that perfect balance. But I think the work part is, yes, this is what I have to do to
Yeah.
get it done, right? And it takes
Mhm.
dedicated people, people who are willing to put the sweat and the tears into keeping that in sight, because it ain't easy.
It's really hard. And I think it's harder as you become further away from the patient bedside, right? As you get further away. So in a system of 100 hospitals, the people who are really making the decisions, who knows the last time they walked into a patient room was? But you need that. That's the grace part. You need that to keep you grounded in the work,
Mhm.
because it becomes very easy to say, we don't need pet therapy. Who cares about pet therapy? Let's not do that. Well, a lot of people do care about it. It makes a lot of difference for a lot of people. But, in my place remotely from where anybody's ill, it doesn't seem that important compared to making sure we have the latest piece of technology. And those struggles are real, and people aren't making frivolous decisions,
Mhm.
but they might be making decisions through a myopic lens instead of a biopic lens.
Yeah, yeah. And I want to kind of knock us off of our focus here for a minute, because it takes me to this great love I have for Pope Francis. It's like I think many of the staunch, sort of dogmatic, traditionalist Catholic wants him to go full steam ahead and you do it our way or there's the highway. He has that wide lens of Jesus, that welcomes inclusion. It welcomes the poor. It welcomes the people who also have very much and challenges them, right? To go that extra mile, to not just think of themselves, but think of the common good. I love one of the checklists in an article I read that you sent me. It sort of ended with this box of check, and one of them was the common good. And I think that's missing sometimes in our politics.
Mhm.
The politics of I worked hard and this is mine. The politics of get it done. You got 8 minutes and show me the money type of thing, right?
Yeah,
Instead of having that wide lens of how do we strive for this?
that's right. And how do we love? And I use love in a generic term, love, but how do we love everybody, even those who we think you caused this problem yourself?
Hmm.
Right? I mean, it gets tiresome to say one more person came in with this self-inflicted injury, whether it's alcoholism or addiction to drugs or a teen pregnancy or whatever. It's easy to say you didn't have to go there. You walk a mile in that person's shoes before what things are you doing in your own life that they could turn the mirror around and say
Hmm.
you're inflicting your own stress injury or your own whatever it might be. So it's hard to say we're going to live in a model of Jesus, but we're not going to love this group. That
Hmm.
that doesn't really work. And I so respect healthcare providers who are able to just embrace the need without the judgment. It's
Hmm.
it's got to be hard. It's got to be hard when they see people all the time who kind of got themselves into this mess, but it's so respectful. I remember working with a physician who was well experienced, well up in years, but just a wonderful, wonderful man. And I said, "How do you think you're going to help her? She doesn't follow instructions." This was a patient who was a severe diabetic, had a lot of cardiac issues. And I said, she's hiding bags of potato chips under her bed in the hospital. And he said, "Everybody has given up on her except me and God. I am not going to give up on her." And it was like he slapped me across the face and woke me up. It was like, yeah, why do I think I'm here? Who am I to judge her? It was really such a beautiful another moment of grace, like such a beautiful moment for me.
Yeah,
So,
I really resonate with that. Just in the sense that so many of us think the God experience is a God that you pray and then you get an answer.
right,
Uh,
right.
it's graced moments where we get these little glimpses of God being with us.
Yeah,
And that's what healthcare people are meant to do. Oh, yeah, sometimes we can fix it through research. We might know more about it through all kinds of experiments and surgeries, and we might be able to fix it. But a lot of times we can't fix it. But I'm right here with you.
exactly. When COVID started, we knew so little, right? I mean, we knew so little about what was going on. And I remember talking to a physician early one morning, and he said, I did surgery on my first COVID patient last night. This patient couldn't breathe, and they were trying to attach some uh, breathing assist device or something. And he said, the machine kept clogging up. Her blood kept clotting the machine. And he said, and I don't know why that kept happening, but she did die in the surgery. And he said, but I will always be grateful for her because from now on, I'll know I have to anticoagulate these patients extremely. And this was before we knew that one of the problems with COVID was blood clotting. It was so new. It was maybe, we were 2 weeks into the crisis in Chicago and they had not yet identified that that extreme clotting was one of the problems that was killing people. But he said, I will always be grateful to her. And I thought that was such a wonderful tribute to this woman who lost her life, but who would save others,
Yes.
and that he would be able to tell her family, what I learned through this, she will save others. It is that seeing and those moments of grace that change everything.
Hmm. If you could influence the decision makers in healthcare, and maybe it's politics, maybe it's a hospital administration. Is there one change you would make or some strategy you would offer that could help us to kind of shift in a way that will be a little bit more that balancing of margin and mission you speak of, or those grace moments of how do we include everyone in this process of medicine?
It's a very long road, but I think we need to flip healthcare upside down. At least in the United States, I can't say this is true across the world, but in the United States, healthcare is very hospital centric. Hospitals create a healthcare community. They put doctors out into the community. They do a lot of things. And the focus is on the care that's given at the hospital. And if we started with the care that's given at home, maybe without a physician, but just, how about nutrition and vaccination and the basics that people need to have a healthier life? How do we make sure that kids get exercise? How do we keep young kids from getting diabetes? Things that are building up to a lifetime of illness then really, which we know, right? We know the data. We know that's why COVID was so devastating to certain communities because they already were disadvantaged health-wise. If we could get a better baseline, giving everybody a better chance from the beginning, I think would make the difference. That if we started to work on prevention instead of cure, we would be in such a better place.
The whole position on trying to live a healthy lifestyle will help us to better prepare for the normal changes that happen as one ages, right?
Right. Right. Science tells us the difference between like what it means if you exercise, what it means if you eat right, and what your genetics means. And you can't escape your genetics, but you can influence the other things. But I think the industry is still driven by hospitals because that's where the revenue is. The big money is in hospital care.
Mhm.
And there's not a lot of money in teaching kids nutrition at school.
Yeah,
It's just, it doesn't happen or at home or however. So somehow flipping this whole thing upside down, the pyramid upside down, so that the hospital is the least desirable part of the system.
yeah. That's a very Western focus because there are places in the world where you don't have big hospitals to go to, and people rely on,
Yeah.
their medicines and their traditions. And before they get to a point of going to the hospital, they've tried everything.
Yes. Yes.
Still, the lifestyle
Yeah.
is still an issue there too,
Yeah.
even when you're not hospital focused. But
Right.
that is something that the U.S. could lead in if we
Right.
wanted to.
Right. So probably the organization that has had the best ability to shift healthcare practice in the last 20 years in my career has been CMS, Medicare. And
Mhm.
they've been very good about driving quality of care and promoting good outcomes and, trying to keep patients safe. And they've added in the last few years, they've added benefits that include nutrition for senior, Meals on Wheels. If you live alone, then you are less likely to cook a meal for yourself. And if you don't have good nutrition, you lose muscle tissue. And if you lose muscle tissue, you're more likely to fall. It's not a surprise
Mhm.
that people age and what happens when they age. So so then Medicare says, gosh, maybe we would have less hip fractures if we could get people to eat because meals are prepared and they don't have to bother to cook because nobody wants to cook for themselves. So they're looking at those things. I think small changes like that could have big outcome, but it'll take time
Mhm.
to change those things.
How we make them profitable, not only for the people giving the service and teaching the methods, but make them profitable for the people who are getting it in the sense that they will not have big bills, have better lifestyle if they can find this balance. As I listen to you talk, especially in this last few minutes, I can benefit myself a lot from this lifestyle. I have my own mobility issues because of all these joint replacements and things. But I think people hearing from a professional that say we need to somehow turn the thing upside down and work from the end of self-care and looking at a life. So I need to hear that, you know.
Kind of goes back earlier. We were talking about people having an expectation that healthcare can be everything.
Mm-hmm.
And so I think it is so good. I mean, the upside of this is healthcare is so good that people believe it can get fixed, right? If this hurts me, they'll be able to fix it. And often that's true. But at what cost to the patient and to the society of,
Mm-hmm.
of those things that could have been avoided in the first place. I can look in a mirror and say, I myself have all these issues that I should be working on. So I'm not saying this in a manner of people are stupid or people should do better. It's not that.
No.
They show up with an expectation that things can be made well, and sometimes they can and sometimes they can't.
I'm a witness to that.
Yeah. Yeah.
The very
Right.
first
Right. All of us. Right.
Yeah. So as we kind of move into the closing, I love talking to you. I can resonate with what you're saying. I can go there. What I ask everybody as we kind of come to a closing point of our conversation is there one truth? You might have more than one, but if you want to share one truth that you live by, maybe something you received from your parents, something you've learned from your career, but one thing that stays with you throughout your life.
I think it's become more acute to me to just define it so simply over the last several years, particularly with some of the divisions we're seeing in our country. Maybe that we're always there, but we didn't see them so clearly. But it's that love wins. Love wins. So if you can design healthcare through a lens of love for the people who are going to receive it, it'll be better healthcare. And if you can live your life every day trying to love everybody around, I mean, this is not easy. Years and years ago, one of my college roommates was struggling through ovarian cancer. And we had a party at our house one night, and she and her husband were there. It was a time when she was in a good place, a remission place. And she was visiting with people who had known her for a long time. And the next morning, there was an article in the Chicago Tribune about how she was trying to get this experimental drug treatment approved by her insurance company for her ovarian cancer, and they were fighting it. And one of the other people that was at the party called me and said, I had no idea Colleen was sick or that she was struggling with this or the trying to get this treatment or anything. She never said a word about it. And she said, I guess we just never know what burdens people are carrying when we talk to them. And that's what I think we have when I say love wins. Like, don't just walk by somebody and assume, everything's great with that person. You have to be open to people. We should all make each other feel welcome all the time, right? If I leave the world doing better with that, I'll feel good.
Well, you live it. You may not necessarily walk around shouting it from the mountaintops, but Tricia, you live it, because every place that I've ever seen you work, include, collaborate, reach out to people, you do it with love, with your heart. And it's something that you don't always have to speak out loud, say, oh, I love you with this. No,
Yeah, right.
It's something that you do.
Yeah.
And it's natural to you.
Well, thank you. But I don't think you do want to speak. I mean, I think you just want to show it.
Yeah.
That's the hard part, to show it.
Yeah.
Yeah. But thank you for saying that. That was nice.
You've brought a really great energy to this topic, and I think people will enjoy it. Thank you so much for being with me. And now for the wrap up. You have just had a human experience from a spiritual being. We have so much to learn. So go forth to love and speak the truth. Ad majorem Dei Gloriam.